At present, advancements in diagnostics are creating a new frontier for healthcare. Pathology provides physicians, nurses, and other healthcare providers with objective information that is needed to prevent, diagnose, treat, and manage disease.
Unbeknownst to most patients, pathology is the place that provides the diagnostic answers for most patients. In fact, I think there's some statistic that 80% of decisions made in a hospital are based on lab results, and that is pathology, and then obviously clinical lab results too. And we're the guys that make the diagnosis and guide the surgeons, the oncologists, tell them what the lesion is, what they have to do. Every time a patient has a biopsy or a lump removed, a pathologist has to decide what it is. The surgeon has no clue till we tell them.
I think the public has a misperception about pathologists from TV shows and from the old literature that pathologists don't interact directly with living patients. And the fact of the matter is that they do, and they have been for many years, because as we get more and more involved in trying to follow a disease, not just at the time of diagnosis, but to obtain tissue and to analyze that tissue so that we can follow the progress of that disease and the effects of our therapy, pathologists are going to have more and more direct contact with patients.
If pathologists do the right job, they can really positively impact on patient care by getting to the right diagnosis promptly, thereby getting the patient into the right treatment algorithm, and possibly even shortening hospital stays, which will save healthcare costs.
For more than 100 years, the United States and Canadian Academy of Pathology, also known as USCAP, has been the global leader for advancing knowledge in the field of pathology.
USCAP, or the Academy, is the largest membership for pathologists and people allied to the discipline of pathology. It is where we come to teach, it is where we come to learn. It is where we become better pathologists, and by doing so, we impact patient care in a very positive way. Our role is education to pathologists, for pathologists, and ultimately this benefits patients.
USCAP, as the leading education provider for pathologists around the world, has a pivotal role in improving pathology education and healthcare around the world. And I think that there are some underserved countries where it's not possible to do a lot of the high-tech testing that we in the developed world can do to provide patients with the best care. But there are many surrogates that pathologists in these developing countries can use that could approximate these more high-level tests at a much lower cost. So one of the goals, I think, is to educate pathologists around the world what techniques are available that may not be the most expensive, but can give them information which is similar to that which you can get from the more expensive tests.
USCAP is a proud member of the International Academy of Pathology.
ASCAP is the premier educational sort of center for all surgical pathologists, diagnostic pathologists in the US, and for many pathologists around the world who come and learn at meetings from ASCAP. And at the same time, it's the place where we all go to present our newest data, our newest findings, the newest research, which then is shared among a large group of people who come to these meetings.
New innovations in pathology are discussed and vetted. And in that way, pathologists around the world are educated with regard to what's cutting edge, and they can then go back and take those back to their own practices, which will in turn elevate the level of their practice and consequently improve patient care.
The largest jewel in our crown, of course, is the annual meeting. It has a wide variety of educational offerings ranging from cutting-edge scientific data to more formal didactic courses on any of a number of pathology topics. Throughout the year, we have a number of other courses as well that are more geared towards practicing pathologists in the community rather than scientific data. We have diagnostic pathology, which again is a series of lectures in a nice vacation-type atmosphere anywhere around the country. We have a cytopathology-focused meeting once a year as well that focuses just on cytopathology for people who have a main focus of that in their practice. And then in terms of the future, we're looking at things like interactive microscopy, where you have actual one-on-one scope time with an expert in any of a number of subspecialty areas.
USCAP is highly selective in its educational content and delivery.
when people encounter a USCAP educational offering, they know that it's been thoroughly vetted and evaluated and it's the best it can possibly be. In addition to our more traditional offerings, USCAP is trying to do a number of things that are innovative in terms of digital offerings. Those are things that we can easily send out into nations that have fewer pathology resources than in North America, or people who just can't afford to travel to North America for a meeting.
Now, with a more global stage and with the website as a medium to connect people, it's possible that somebody far away who can't attend the annual meeting can find avenues to produce their work and showcase themselves. It's also possible for them, on the flip side, to receive more information and get new ideas.
Many of our courses are taped and then put online. Many of our CME offerings are online case presentations with tests. This is also going to be very important for people who need to get a number of continuing medical education hours to maintain their licenses. So there are a number of things that we're doing through both just taped courses put online and interactive digital offerings.
There are at least 4 major live meetings that we have each year that draw up to almost 5,000 pathologists from around the world. Pathology education takes place in these venues as well as in web-based offerings and in more informal ways through hallway conversations at national meetings, sidebar consultations that occur when pathologists see each other in less formal situations, etc.
Modern medicine and the medicine of tomorrow that's going to make outcomes for patients better requires bringing discoveries from the laboratory to the bedside as rapidly as they can. And that effort is something we call translational research. And pathology and any other discipline of medicine now needs to have that unique combination of science and of clinical care.
So in 5 to 10 years, the question is whether surgical pathology will be a primary diagnostic test or really be viewed as an ancillary diagnostic test. I think that surgical pathology will remain at the forefront of the diagnostic test, and I still think molecular and genetic testing will be viewed as ancillary diagnostic tests. I still think it comes down to what you see under a microscope.
To me, the major value of USCAP is the collegiality. I think that the collegial nature of the USCAP members can't be overemphasized, and when pathologists from around the world get together, it really is a perfect example of the whole being greater than the sum of its parts.
USCAP provides pathologists with high-quality information at the investigative and applied practice level to reinforce and update their knowledge of pathology in their unique areas of interest. For more information, visit uscap.org.